Hey Rivers Flock, how's it going? It's Mills RX here, and welcome to the training room. I'm going to show you exactly what the medical staff is looking at when they clear someone to return to practice, or if someone has suffered an injury that will probably knock them out of the game or something. Of course, they go for initial X-rays and stuff like that, and I'm going to be showing you, what the medical staff is looking at, what the training staff is like dealing with when they design rehab, and also how to they try to get players back on the field by getting an in-depth look at the injury. So I'm going to be showing you that three injuries, the main injuries that has knocked out three impact players for us: Rashod Bateman, Justin Houston, and Justice Hill. So that's we're going to get into. So we're going to be getting a little technical here, but I'm going to try to explain it in in the most user friendly way as possible. So I'm going to click away. So I'm going to click away so we can get into it. So yep, here we go. Welcome to the training room. This is Ravens Physical Therapy. As I mentioned, I rebranded my YouTube channel, the Ravens Medical, and this is just one of the the neat ideas I had. Maybe show you a little bit more. We'll go more in depth with the injury, and so you can get maybe a better understanding of it. So let's go ahead and go to the first injury. You get there. It's Justice Hill. Now, if you look on the injury report, you would see a hamstring injury. Yep, hamstrings. But that's not really descriptive. And then you probably would get an article when they get more information saying, "Oh, he's dealing with a hamstring strain." Now, there's three grades to many injuries. Grade one is mild. Grade two is moderate, and grade three is severe. Now, Justice Hill is dealing with a grade one hamstring strain, so a mild hamstring strain. Now, what I believe is that he has overworked. Now, that's the official diagnosis. Now, more in depth is I believe he's overstretched or overworked the myotendinous junction. Now, if you take a look at this picture over here, you can see you have your leg bone right here, your femur, that's behind it, and you have a hamstring muscle. You have three muscles. You have three muscles that make up the hamstring. You have the semimembranous, you have the bicep femoralis, and you have the semitendinous. Now, this is just a graphical illustration of a hamstring muscle. You have the proximal hamstring tendon right here, and you have the distal hamstring tendon. Now, proximal means close is. Now, the proximal one is closest to the femoral head or the head of your leg bone, and your distal hamstring tendon is closer enough to about your knee. So this right here is called the muscle belly. This is the biggest part of the muscle. This kid has all the muscle fibers, all of them lined up and things like this. And because this is closest to the head of the femur, this is your proximal muscle belly, and this is the distal muscle belly. Now, what I believe Justice Hill injured is this area right here, known as the muscle tendon junction. Now, in medicine, when you hear the word myo, you immediately start thinking of muscle because myo means muscle. So if you put these two together, so this is your tendon, this is the muscle belly, myo, and this is the tendon right here. This area right here, the the muscle tendon, the myotendinous junction is where the muscle belly and where the tendon where they meet. As you can see right here, the skeletal muscle right here, the muscle belly is connecting to the tendon right here. Now, where I believe Justice Hill hurt himself is in the proximal myotendinous junction right here. I believe he strained this area right here when he was running, and when he ran, he pulled up lame, and when he did pull up, it pretty much just overstretched, and that's why he was limp. He had a hitch in his giddy up when he was running. He was immediately holding it, and it looked really painful because it probably was. Now, the recovery timeline for this is 1 to 2 weeks. he could potentially return next week. But seeing how cautious we're being, I think we hold him out for the 2 weeks, just so this area right here can heal and possibly regain some continuity, and so he can get the elasticity and the tendon and the tendon itself can heal because he probably hurt that as well too. So now so now the medical staff will be looking at this. This is a coronal T. This is an MRI, a coronal T1 MRI. This one right here is giving us a top view of it right here, and this circled area right here. So as you can see, right here, this is the myotendinous junction. This is the myotendinous junction right here. You see, you have the tendon up here, you have the muscle belly down here, and this is the area right here that is strained. And when the medical staff would look at that, or when the physical therapist looks at that, they would say, "Oh wow!" They would say, "Oh wow!" This space right here between the proximal muscle belly and the proximal tendon right here has been overstretched, possibly even hyperextended. Yep, yep. I don't say he would be ruled out. I mean, now in theory, he could maybe potentially have like maybe a lidocaine injection put in here if he was truly wanted to play, but that's really just a band aid, and you want this to heal, the muscle to heal all the way. Even the tendon, he may have hurt the tendon up here as well too. So, yeah, this is what the medical staff would look at, and this is what the physical therapist, or in our case, Dr. Andrew Tucker, who is the head doctor, or the head who's the medical director of the Ravens, and Adrian Dixon, who is the head athletic trainer, who we signed and who we got from the Tennessee Titans. They would look at this and they would say, "Wow!" They would say, "Yeah, Justice can't go because we need this to heal before he can even think about practicing." As you saw, he didn't practice all week, so yep. Hopefully, he can that this can heal up and we can get him back next week. But I believe we'll hold him out 2 weeks. Next up is the big injury of them all would be Rashod Bateman. Now he's of course he's our first round pick. He's our wide receiver one, and he's dealing with a left midfoot sprain. Now when you hear midfoot, people immediately go to the Liz Frank, and it makes sense because Liz Frank is a very important ligament. It is that it is the most. I'm not gonna say the most important, but it is a pretty big ligament, and these and but there's so many more ligaments in the middle of the foot, as you can see. You have so you have what's known as cuneo cuboidal ligaments, and also you have cuneiform ligaments, and also you have the this one right here, which is known as the calcaneo-cuboid ligaments. But those are the three main ones right here. You have metatarsal ligaments, cuboidal ligaments, and cuneiform ligaments. Those are the three type of ligaments that are found in the midfoot. And of course, you have the Liz Frank ligament, which is the main one people focus on right up here. So right up here, kind of between the first and second metatarsal right here. So that's the mode, but there's so many other ones that are in the middle of it. So what I believe, so you would really just see foot, but Coach Harbaugh was nice enough, and he told us that he was dealing with a midfoot injury, and because the severity of it, I believe it's a midfoot sprain, and the Liz Frank ligament is intact, so it's not a Liz Frank injury. Thank goodness for that, because if it was a Liz Frank injury, he would be out 4 to 6 weeks, and that's not good. But see, what I believe what he did was he hyperextended the plantar cuneo-cuboid ligament and the plantar cuneo-avicular ligament. That's a cuneiform ligament right there. So I believe he did this one right smack dab in the middle of the foot, the small one right here, the plantar cuneo-cuboid ligament, and these two on, not that far away from it, the plantar cuneo avicular ligaments. I believe that he hyperextended this complex, about three in all, this complex of ligaments right here. Now, what's important about these three, like they, as I mentioned in the flock checkup, every movement this foot makes, it bears weight. You bear weight on your foot. You, like, say you take a walk down the street, you jump, you run, you cut, wide receivers do. These ligaments right here, they absorb the majority of the shock and also the majority of the weight and disperse it throughout the middle of the foot, so that the arch, and they also form the arch so that the arch doesn't collapse in on itself because of the dynamic movements that wide receivers make. Now, when these two are injured, like Rashod Bateman did, they can't absorb that much, and the majority of the pressure and of the weight is put on the bones and stuff like that, and that's not good because then that will cause skeletal problems. And because the soft tissue isn't supporting, so these metatarsal bones right here, all the pressure gets pushed up to these bones up here, these are your metatarsals right here, and that could cause fractures, that could cause any number of skeletal problems in the foot, and then he won't be able to walk at all. So that's why, and you saw him, he was in a boot. He was able to walk because that boot is probably padded and his foot is probably wrapped up to keep these ligaments in the anatomical positions where they are. Now, the, what the medical team and what the doctor would be looking at, they would be looking at this. This is apologies for the crude imagery, but this is an X-ray of the middle of the foot. As you can see right here, the Lisfranc injury, the Lisfranc ligaments right up here. This is intact. You see the intermetatarsal ligaments right here between the two metatarsal bones. And the intercuneiform, ligaments, and the cuneo-cuboid ligaments. Now, if you remember, the plantar cuneo-cuboid ligament is right here, right smack dab in the middle, and that absorbs the majority of it, and it's helped out by these two cuneiform ligaments, the plantar avicular ligaments, and they help disperse the weight. And really, I expect Rashad to miss 2 weeks at least, but he could easily miss a month. So these two have to heal. They need time to heal. You cannot rush them back. So we're going to be without Rashad Bateman for a while, which is not good. But hey, that's the nature of it, and hopefully we can get him back healthy in time toward the later parts of the season. Next up is Justin Houston. Now, he has had a nagging growing injury, which has really limited him. He's not being able to practice. We saw him on the sideline, just standing there. He looked like he was in pain, and he just hasn't been on the field in a while. And what I believe he did, and it's looking closer to the second one. Originally, I thought he had just overstretched, or he just overstretched a adductor muscle. I know you've seen this word a lot, overstretched or overworked. That's what a grade one is. Grade one sprays normally are just like, you stretch your muscle too far or something like that. But now that he's ruled out, and he's been ruled out for a while, I believe he has a grade two adductor injury, which is a partial tear. He may have partially torn one of the adductor muscles in his groin. Now, if you look at the picture right here, these are the adductor muscles in your groin and your pelvic region. You have your pectineus, you have the adductor brevis, the gracilis, the adductor magnus, and the adductor longus. Now, as you can see, the adductor longus is the biggest one. It runs from from your pelvic bone all the way down here to the side of your femur. Your magnus kind of branches off of it, and you see the pectineus, kind of branches off of it. It's kind of up here closer to the pubic bone. The magnus is kind of down here closer to your knee, but they all branch off of the longest. And you see the brevis muscles on the other side. It's pretty big too. And you see the gracilis one is more along more along the inside of your thigh, more along the inner side, the medial or the inside portion of your thigh. Now, now all of these are usually can be strained or hurt at any time, as we saw Marlon Humphrey. He had an adductor strain, and it's probably this one, but the one that's most likely strained is because it's the biggest, the adductor longus. And if you were to tear this muscle, you would be out for the season. If you were to completely rupture it, which is a grade 3 injury, you're out for the season because you won't be able to move that leg without screaming in pain. So now it's still possible that it's a grade 1 injury, but given how it's been hurting him and how he's not being able to practice, I believe it's a grade 2 strain, and he could be out. And 3 to 6 weeks is the recovery timeline for a grade 2 strain. Now, if it was a grade 1 strain, 1 to 2 weeks, he may have practiced this week. But since he didn't practice, I'm more inclined to believe it's a grade 2 strain. Now, 3 to 6 weeks is the timeline. I'm gonna say I'll give it a month. I'd say a month at minimum, and then 6 weeks at the max. But yep, that's what I believe is, and what the doctors and what the medical staff would be looking at would be this. This is your pelvic region. So this is an MRI of your pelvic region. This right here is your adductor longus muscle right here. And here is the strain. That's where the strain right here. This dark area right here, that's where the strain is. This is a frontal view of it. This is a side view of it right here. And once again, this is your muscle. This is where the strain is. You see it's a little darker, this dark region right there. That is where the strain, that's where the strain is right there. That's grade 1. Now, this right here is a tear. It's a bit darker, and you can see there's slits, these small slits right here in the muscle. That is where the partial tear is. Now, if it was all the way across, that would be a complete rupture. He'd be out for the season. And this, once again, the side view, this is where the cut is. This is where the tearing is happening right here in the adductor longus muscle, and that will keep him out. I'm good, like I said, at least a month. So hopefully we can get him back like Rashod Bateman in the latter parts of the season, and hopefully we're still in the race when it happens. So, yep, that is what our medical staff is looking at when they go and do examinations and get imaging on the players from these injuries. And hopefully I was able to give you a bit more of a technical understanding of what we're looking at when we look at these injuries. So, yep, that was thanks for coming into the training room with me. And once again, it's Mills RX. If you like this content, please smash the like button and subscribe to the Ravens Medical channel. And also, follow me on Twitter, Game Medicine. And I hope to do more content like this. And if you like it, I'll do another one. But hopefully, I won't have to do too many of them because the injuries keep piling up, and it's just not good. So, yep, you have a great weekend. I will see you Sunday night for the game against the Bengals, the Ravens.